Welcome you all, and Dr. Vikram here for another episode with Menopause Support Circle. And we can't be very much thankful, appreciative of your time.
Yeah,
We all know about Vikram. I think I don't have to get in details. I will quickly say whoever is new. No, he's such a modest person. He doesn't want it, but it's my pleasure to share about his credentials. Credibility. He works with London Hospital. I would say he services at London Hospital, and he's an assistant professor with the London Hospital College of Hospitals, and he is also contributing a lot immensely in the reproductive area of women. What else? I forgot. He has been associated with even menopause policy. Lot of accolades. I may be putting it in short. But let's not waste more time because we are here to learn from him. We are here to take out all the information that he can share with us. Here you go. Over to you, Vikram. One word is that please use it
thank you.
as education purpose. This is not a consultation. So please refine your questions to the education purpose. All to do with that. Over to you, Vikram.
Thank you. Thank you, everyone who has joined on a Sunday for giving up your time. So today's session would be continuation of the last two sessions. In the first one, we just talked about what is perimenopause, menopause, the changes that happen. The second one, we talked about the various ways of trying to optimize health after things like surgical menopause, premature menopause, what are the various lifestyle, non-hormonal, hormonal options there are to try and make sure your postmenopausal health is optimized. And today, again, we are going to focus mainly on the long-term effects. So although I have slides which start from the beginning definition right till the end, we'll be focusing on the part that is what are the symptoms that women will have going through the transition, and what are the long-term impact on the bone, on the heart, on the brain health, on the metabolism, and what are the options, what are the simple things that can be done to optimize this health, whether it's hormonal or non-hormonal options. So I'll try to share my slides in a second. So if I go and say share, are you seeing my screen, Sharmila?
Yes.
Okay, we'll
Wait.
try and share that.
Yes. They are unable.
Okay, so do you see the slides?
Yes. Yes, Vikram.
Yes, we do.
Thank you, thank you. So this is the bit that we actually focused on the last time, which is trying to define perimenopause, menopause. So I'm going to skip that. And just a quick review, because we are going to talk about the long-term impact of what happens during menopause and the hormonal changes. Just a quick recap on when do we think the actual transition begins. So the first bit is the premenopause. This is before any changes to hormones or any changes to body tissues, organs have happened. This is when a woman would be expected to be having her regular monthly menstrual cycle. That's premenopause. The first stage when the menopausal transition begins is the perimenopause. So this is when hormones start fluctuating. Estrogen levels will be going up and down on a daily, weekly, monthly basis. The FSH, LH, other hormones will also be fluctuating up and down. And this phase will usually last for 2 to 5 years for most women, between 45 to 50. Now, that's mainly for women in the Western countries. In, say, Southeast Asia or other countries, it might be a bit earlier. So, even between 40 to 45 or 40 to 50, within those 5-10 years, there will be changes to hormones. The estrogen levels will be declining, the testosterone levels will be going down, and some women may start feeling symptoms. So during perimenopause, although periods may still be happening, symptoms such as emotional symptoms, low mood, depressive thoughts, symptoms like headaches, migraines, irregular periods, symptoms such as sweats, flushes, difficulty sleeping, lots of joint pains, vaginal dryness, they all may start at this point. And then, of course, we say it's menopause when periods stop. When the periods have stopped for a year, that's when we diagnose somebody has definitely gone through menopause, and symptoms will be quite pronounced at this point. And finally, post-menopause, this is a phase of the last 30-40 years of a woman's life. 1 year since stopping period right until the end of life. That's a lot of number of years. And that's why we are talking about long-term health, the bone, the brain, the metabolism, the heart, because these 30, 40 years, we want to make sure these are the healthiest years of the woman's life. I'm going to skip some of these. And again, the point to make on this particular slide is that remember, although the median age at menopause is 51, most women will have menopause around 50. Early menopause affects about 1 in 10 women, so that's between 40 to 45. 1 in 10 women will go through an early menopause. This has more impact on the bones, on the heart, on the brain health. So it's even more important that these women look after their health after menopause more. And then premature menopause is below 40. So very, very young, below the age of 40, having menopause, often sometimes surgically because of having to have remove ovaries or have hysterectomy. In those situations, the impact on the bones, heart, and the brain is very, very strong. And it's really important that these women get good care to protect their long-term health. The average age in India is thought to be around 46 and a half. And so it's 5 years earlier than what we say in the West in the counterpart women. Now, how many women will experience symptoms? 80% will, but there's a lot of variation in the nature, the severity, and duration of symptom. So I'm often asked, what if I don't have symptoms? That's okay. A lot of women may not have symptoms or minimal symptoms, and that's very good. Then you don't need to consider a medical intervention. But there are a number of women who actually suffer thinking this is physiological process and put up with, say, low mood or put up with joint pains or put up with anxiety, put up with a lot of sleep issues or flushes and tiredness, not recognizing that this is actually menopause. And only when somebody else tells them that there is some change in their functioning, then they realize this could be actually menopause or perimenopause, and I'm going to a change with my hormones. So there's a lot of marked variation. You can have very severe symptoms, which really are debilitating for day to day life, but you can have mild symptoms, which you may be able to cope without any medical intervention. If you have medical or surgical menopause, especially say chemotherapy, or you've had a hysterectomy for bleeding or fibroids and the ovaries are removed, that's quite sudden for the body. That's when the body will have maximum changes because of sudden drop in estrogen, testosterone, because the ovaries have been removed. So you're kind of pushed into menopause within 48 hours. And that's something that's really important to keep in mind, that you will need to look after your bones, heart, and long-term health. One of the important bits to remember is menopause affects head to toe. Almost all organs and tissues in the body will be involved, either in the form of symptoms or what happens for long-term health. So to kind of summarize what impact this lack of hormones is having on the body, you can see the symptoms can start right from the top, which is headaches. Migraines or headaches become common during menopause. Brain fog, feeling like you're losing memory thoughts or chain of thoughts, or memory becomes very less effective than it was before. You often don't remember the sentence you were trying to say, or you often find that you may not be able to recollect something which you could previously recollect very well. Low energy, fatigue becomes common because of lack of estrogen, testosterone. Hot flushes, night sweats, sleep issues, these are often together. But even if there are no hot flushes, night sweats, the sleep can itself be disturbed because of the changes to the hormones. Low mood, heightened anxiety, palpitations. Many women complain of this during perimenopause, going through to menopause. Irregular periods will be common during early perimenopause. Then there are other effects like the dry skin, the itchy skin, dryness of eyes, or joint pains and aches, aching muscles, aches and pains all over the body, often typically lack of estrogen. And then symptoms like vaginal dryness or painful sex or drop in libido, sexual desire, sometimes bladder issues, leaking or going to the toilet too often, cannot control the bladder. These become common again because of the changes to the hormones. And then there are long-term effects. So long-term effects, we talk about four main effects. We talk about effect on bones, we talk about effect on heart, we talk about effect on the brain, cognitive function, and we talk about effect on metabolism. So what are those four important effects? One is the bones. So as somebody goes through menopause, they will have a losing of their bone density. So estrogen is very good for bones, because as the estrogen becomes less, the bones start losing their mineral density. And if you have additional risk factors, like there's family history of osteoporosis, or you're taking some steroid medication, or you smoke or have excess alcohol, in all those situations, you will have increased risk of fractures because of the lack of bone density. So one of the important things we often say is looking after bones when you go through menopause is really critical. The second is heart. Estrogen protects the heart and the blood vessels. It makes sure that the heart and the blood vessels remain supple, the blood pressure remains good, the good cholesterol is good, and the bad cholesterol remains down. The moment the transition happens, the estrogen levels have dropped. The bad cholesterol, the LDL cholesterol, starts going up, and often atherosclerosis or having the clots in the blood vessels, that becomes more common. And that's why estrogen decline during menopause transition can accelerate heart disease risk. The same thing happens with the brain. So earlier the menopause, if women have premature or early menopause, it is known that the changes to their blood vessels, to the blood vessels in brain, will often accelerate the process of cognitive decline. So they have a higher risk of having cognitive decline later on in life. And finally, metabolism. Earlier the menopause, higher the risk of diabetes, because estrogen helps insulin function. So the moment perimenopause, menopause happens, insulin function goes down. And so chance of diabetes, type 2 diabetes, and insulin resistance increases. Often this is the reason why many women will put on weight around the middle of their body. That happens during perimenopause, menopause, 40s and 50s, because insulin function is getting slower. And so again, the risk of diabetes goes up there. So in making sure that this is the time you're addressing your diet, addressing your exercise, that would be really key because of slowing down of the metabolism. So those are the four important sort of long-term effects on the bone, heart, brain, as well as the metabolism, which we need to address during postmenopause. How do we address symptoms? Of course, there are lifestyle modifications, there are changes at workplace, there are nutritional or self-help interventions, there are alternative therapies, there are non-HRT medications, and HRT. So one of the important bits is there are symptoms, there are long-term effects, and both can be addressed by various interventions. Some are good for symptoms, not so good for long-term health. Others will affect symptoms as well as be important for good long-term health. And the aim of all of them is to try and improve the quality of life and try and improve the long-term health. So let's look at one by one, and then we'll probably jump to the HRT next. So let's start with the lifestyle modification. So lifestyle modification, the most important bit is making sure that it's good for metabolism, bones, heart, and brain. So one of the first things is diet. Particularly in relation to menopause, there's no specific one diet that's been recommended. What is important is to eat healthy. And so things like making sure you have small portions throughout the day rather than two big meals is important, so that you give body little by little throughout the day. Mediterranean type of food is always better. So avoiding too much sugars, too much calories, avoiding fast foods, avoiding saturated fats or oils. Typically Mediterranean fish, greens, cereals, lettuce, all those fruit and vegetable rich diets, fiber rich diets, those are the ones that are recommended. Some women may find that if they increase soya, tofu, some of the phytoestrogens like this in cereals or lentils or pulses, they tend to have weak estrogenic action, and they may sometimes help with flushes and sweats and a few symptoms. So including phytoestrogens in the food can always be very useful. Another bit about diet is having enough vitamin D, calcium. So vitamin D, unfortunately, there's not enough in the foods. So often we recommend supplementing with vitamin D. So if you're exposed to a lot of sunlight, you might just make enough vitamin D in the skin. But most of us are usually housebound, or we have workplace in the office or in the building where we don't get enough sunlight. So then vitamin D usually helps. Just 1,000 units of supplement every day will usually be very good for your bones. Calcium should come through diet. So whatever calcium we recommend, ideally through dairy, milk, cheese, butter, yogurt. There are other green sources like green leafy vegetables. You have eggs, you have broccoli. These are all rich sources of calcium, including cereals. So trying to get enough calcium through food is ideal. But if the diet is deficient or if you can't have dairy, sometimes we advise supplementing calcium with the vitamin D. So that's in terms of the food. Now, what about exercise? Usually, any form of exercise that you choose should be the one that you will stick to. So, making sure that you exercise in a way that is enjoyable and you will do it every day, at least 5 days of the week is important. And that's usually 150 minutes in a week. So 30 minutes every day, half an hour. That would make 5 days of 150 minutes of exercise. And try and include a variety of exercises, whether it's yoga, it's Pilates, it's a little bit of cycling, walking, or sort of jogging, brisk walking, running. Anything that's against gravity will be very good for bones. We call it weight bearing exercise. Similarly, if you're lifting weights, a little bit of lifting of weights, maybe 10 minutes as part of the routine, is very good for muscles, balance, and the bones. So, a bit of weight bearing exercise, weight lifting is very good in perimenopause, menopause for muscles, bones, and balance. And then, of course, other bits of lifestyle are equally important. So, having good sleep hygiene. A lot of us now carry our phones to the beds. We watch TV screens before going to bed. It's ideal that's not done at least 45 minutes before, so that you follow a strict, good sleep hygiene routine, at least 7 to 8 hours of sleep, no screens before bedtime, making sure the temperature is right. If you get some worrying thoughts, then you make a diary and keep writing, and then go back to sleep whenever you're disturbed with thoughts. All those small things. There are some apps which can be useful for sleep. So this would make sure that you get enough rest. And then finally, things like stress reduction, meditation. If you're worried about something, if you're distressed, or if you feel very low mood, even considering counseling or a psychologist to help you look through the CBT way in terms of solving some of the difficulties that you're going through, that would be key. So, all that encompasses the whole lifestyle box: the diet, the exercise, the sleep hygiene, and the stress reduction. Very important. The second one is changes at workplace. Now, changes at workplace meaning that you may optimize your work environment to try and both help your symptoms as well as protect your long term health. So, making sure that the temperature is right, you're able to comfortably work. If required, seeking help from your managers to make sure that you have access to hydration, cooling. Your shift pattern can change. For example, if you're having particularly terrible symptoms at a particular time in the day, and if you have flexible work shift patterns, then trying to get those patterns which are more suitable for you. All those would be sort of small things, changes at workplace, which might help. Some women are expected to wear uniforms. So again, trying to negotiate a uniform that wouldn't cause a lot of symptoms, for example, would be yet another example of how small changes at workplace may make life easier. Nutritional self-help intervention, we talked a little bit about this. So again, there is no magic diet, there is no magic supplement other than vitamin D. Really, you don't need any supplement. The only time you would need it is if you're deficient in iron or deficient in B12. Then we often say take vitamin supplement. But other than that, most of the commercially available supplements are of no use at all. So having good healthy diet will give you all the nutrients that you need. And then self-help interventions would be seeking CBT, exercising, keeping a diary, anything that helps your psychological health. Alternative therapies, some women try to go down the route of acupuncture or homeopathy or hypnotherapy, Ayurveda. There are herbal treatments, the different Chinese herbs which are available. Unfortunately, there's not a lot of scientific evidence that any of these help in the long term. So some women may find these useful for temporary stage of time, acupuncture or herbs. There's no long-term safety and efficacy data. There are no good scientific studies. So we don't recommend alternative therapies. It's either lifestyle or you could go for non-HRT or HRT medications. There are some non-HRT medications, and these are mainly for symptoms like antidepressants for low mood, or hot flushes. There are some other medications like gabapentin which can help with pain in flushes. We often don't recommend these because you can have a dependency on these medications in the long term. So unless we are treating depression, we often will not recommend antidepressants as first line. And finally, of course, a word about HRT. So women who try lifestyle modification still have a lot of problem with the symptoms, are not able to function. They'll often find HRT very useful. So hormone replacement means taking estrogen, progesterone, and testosterone sometimes. And these hormones can bring back a lot of quality of life because you'll often function better brain wise, the flushy sweats will disappear, the mood will be better, the joint pain should disappear. And often HRT has its own benefits and risk. So we often try to balance the benefits and risk to say, is HRT right for you, or is non-HRT or lifestyle makes more sense for that particular individual. I'm not going to talk a lot about HRT. That's because it's one of the options, and it's something that we can always talk more about in the question answer session. But it's important to know that there are various lifestyle non-HRT, HRT options you have to try and improvise your quality of life. The one thing about HRT that can help certainly is the long-term health. So unlike the non-HRT medication or other interventions, just like lifestyle, HRT can help with bones. It helps new bone formation, so protects the bones. It helps with the brain function, cognitive function. Often HRT started early can prevent late onset cognitive decline. It keeps the heart supple, the blood vessels supple, so often helps with preventing heart disease in later life. And of course, it helps with metabolism. Some women find that they become more active after starting HRT. It help them to keep their metabolism better and help with weight loss as well as help with keeping the risk of diabetes a little away. But again, HRT is not for everyone. Some women may think that the benefits don't outweigh a small increased risk of breast cancer, which is associated with HRT. And for them, maybe HRT is not the right solution. So everyone has to choose which option they realize or which option they find best for them and make sure that they follow it so that they are protecting their long term health. This is mainly about HRT. And so we're going to skip that for today and hopefully touch that in the next session or at the question and answer. And I've already talked about some of the lifestyle and the alternative therapies. So I'm going to stop at that and I'm going to say we can leave HRT for next time, but we will go to question and answers from there so that we can hopefully take questions from you as well as share any experiences you have for us. So I'll stop sharing in a second.
Thank you so much for all the insightful information, Vikram.
No worries. And if there are more questions, of course, Sharmi, you can collect them for us and we
Yes,
can
yeah,
always come back to you. And if
yes,
you do put it on the YouTube, send the link to me so I can share it here as well.
yes, sure, definitely we do that. Thank you for all of your
Thank
participation.
you. And apologies for the delay. Apologies for
No,
starting late, but I think we got there in the end. So thank you.
yes,
Thank
thank
you,
you.
doctor. Thank you.
Have a good
Thank you so
evening.
much, doctor. It was very
Bye.
Have a good
informative. Thank
Sunday.
you.
Bye bye. Bye.
Bye bye. You too. Take care.
Where? So apologies for the delay. So sorry.
No problem. No, no, not at all. Let us then straight away jump to the session.